Good evening, everyone. My name is Henry Baskins. I'm the Executive Director of the Community Relations Council, and I'm so glad to see you out this evening to get information that could only help the communities in South Carolina. I'd like to especially thank Senator Lori, for coming out tonight. Thank you very much for being here. A special thank you to the Richland Library for all that you do in supporting community activities. You guys do a very good job of making sure that the general public in Richland County is educated, and thank you for that. With us tonight, we have some very astute and educated panelists who have all the information you would ever need to know about the Affordable Care Act, right? Right. This particular event is to help with what do we do on the questions you have with what do you do in phase 2 of ACA, Affordable Care Act? What do we do? What has South Carolina done? I found out some interesting information tonight. I won't give it away, but earlier today I found out some interesting information on South Carolina that may surprise you. In addition to that, the organizations you see represented have always been organizations that gone out to help with sharing public information, educating our public so that we do a better job of being a good place for people to live, work, and raise their families. With that being said, I'd like to introduce our panelists. I'll start on the far end. Sue Berkowitz. Sue is the, are you director or CEO? Director. The director of the South Carolina Appleseed Legal Justice Center. In addition to Sue, we have from the Palmetto Project, Director of Programs, Shelley Quinga. And Shelley, I hope I pronounced your last name correctly. Thank you. Also with us tonight from the South Carolina Progressive Network is its director, Brett Bursey. Thank you, Brett. Yeah. We're going to start tonight by asking some general questions and ask each of you to answer one or two general questions and then have you give us your area of expertise, information on your area of expertise. The first question I'd like to open with, and pardon me, I did not bring my reading glasses, so if I put this paper really close to my face, you know why. Oh, good. It's all clear to me now. What can you share with the audience about health insurance, about the health insurance marketplace? What is key for the audience to know about the marketplace? Sue.
Well, one, the world didn't fall apart when the marketplace opened up, and actually it made health insurance, affordable quality health insurance, accessible to more people. In South Carolina, we don't have a state-based marketplace. The marketplace is through healthcare.gov, although we do have 5 now state plans of insurance that are going to be sold on the marketplace. And for those of you who have never looked at it, it's not a brick and mortar building that you go to. It actually is a website, healthcare.gov, where you can go and put in your information into a very encrypted, very safe platform where you give information about where you live and your demographics and your income. And then it will help you see what plans are available, the costs of the plans, but more importantly about the marketplace is if you go through the healthcare marketplace, the cost of the plan may not be what it actually costs you. Because of your income, you might be eligible for a subsidy to help you with both premiums and with cost sharing that will help make health insurance even more affordable to you when you're going to be a health care consumer.
Thank you. Then the next question, general question, is who can buy coverage in the marketplace? Shelley.
Well, anyone who is a U.S. citizen or is here legally can buy insurance through the marketplace. The difference is how affordable it might be for you to buy insurance on the marketplace. So, for example, an individual who on their tax return is just a single individual who makes about $20,000 a year could go to the marketplace and buy insurance, and they would also be eligible for financial assistance towards the premium, towards the copays, the deductibles, the out-of-pocket costs for actually using your insurance. That same individual, let's say their income goes up to $50,000. At that point now, the individual is going to get very little financial assistance, maybe none. So as your income gets higher, then those assistance levels drop down, and then at some point, you are not eligible for any assistance, but you could still buy a plan through the marketplace if you chose to. Yeah. In South Carolina,
Okay.
there are a group of people who are not eligible to purchase insurance that would be affordable. So could you purchase it? In theory, yes, if you had some grand benefactor to pay the premium for you. But if you're a person in South Carolina who in 2015 will make less than $11,670, there is no affordable insurance available for you. One of the options in the Affordable Care Act, as the law was written and then interpreted by the Supreme Court, is that Medicaid could be expanded to cover those in our state with the lowest incomes, but that was a state option. It was a state decision to do that. Our state elected not to do that. So that means that those in our state who are at the very lowest incomes have no comprehensive insurance available to them that they could afford.
Thank you. Lee, I'm uninsured. Am I still required to get coverage in 2015?
Yes, in 2015, we are still required to get insurance. There are a couple of exemptions that you maybe apply for, and so depending on your situation, that's something that it's worth looking into, but however, Americans are required to get health insurance in 2015. Great,
Thank you.
Correct. There are exemptions, for example, income, as Shelley mentioned, if you make below that $11,670 or what the federal poverty level is, then you would not be required to pay the fine because you cannot afford to have health insurance.
But you have to affirmatively apply to be exempted from it. You can't just know that you're poor and you can't afford insurance and therefore you wouldn't be fined. You have to go through the process to apply for that.
To understand that correctly, I need to go that determines that I don't qualify at that income level in order to be exempt.
Correct.
Right, and there's some important reasons for that. One is certainly that we want to make sure that if you were to file taxes, because you could make a lower income, but you still want to file your taxes so that you can get, let's say, earned income tax credit back. Well, when you file your taxes, you would want that certificate showing that you were exempt from the shared responsibility payment, that penalty kind of fee. The other reason why we would like you to do that is because your income may change in 2015. Right now, I may think my income is going to be under $12,000, but what if I get a job and in February, March, April, all of a sudden I think I'm going to make $12,000? I would want to go and get insurance. I need that mark in time saying that I was not eligible then so that I can go in later and get coverage. So everyone needs to go through. The other reason, there's a third reason to go through the process, that is because South Carolina, although we don't have Medicaid as comprehensive insurance, it doesn't meet minimal essential coverage requirements for people at the very lowest incomes, we do have a slight expansion to our Medicaid program called Checkup. So what that program would do would be to provide you with a physical every 2 years and access to family planning services and health screenings that are appropriate for your age or family history. So, for example, this would be a way for us to help folks get coverage for mammograms when they're 50, for colonoscopies, for PSA tests, blood pressure screenings, cholesterol screenings. It's a screening. If we determine that there was a problem, if your doctor said, well, you've had your mammogram and unfortunately there are problems, it doesn't provide you with insurance, it provides you with the screening.
Right, but now you could be eligible under the breast and cervical cancer Medicaid program, which is up to 200% of poverty. So you
have
should,
the right parts.
if you have the right parts. So you want to make sure that you're actually talking with someone who understands the whole process of the health insurance marketplace and Medicaid, because the other piece of the healthy checkup is if you're over 100% of poverty, or you're at 150% of poverty, or 139% of poverty, and you had decided you weren't going to go purchase insurance, that might be a little bit more of an incentive for you to go purchase insurance at that point, because you now know that you have a condition that needs either medication or surgery, and so you would want to make sure that while you might not be eligible for Medicaid if you're below 138% of poverty, you can't get Medicaid for care for that particular sickness. I mean, if you have breast and cervical cancer, yes. If you have colon cancer, no. So you choose your cancers wisely, I guess, is the particular lesson in that. But what you want to make sure you do is, if you're eligible for purchasing insurance and you do find that you have something that needs care, that might be the reason where you didn't think it was worthwhile, or you tried to be exempt from it. That might make it worth your while, because you're going to need medicine, or you're going to need a procedure that would be really helpful for you to have quality of life, or even to continue living.
Good, thank you. Before we continue, some folks in the back can't hear you, so make sure that you speak into your mics. And for our audience, if you have a question that's specific to your needs, if you would write them, we have cards and pencils that we can pass out. Please write your questions, and we'll we'll ask them of the panelists. Brett, explain to me what the penalties are if I don't have coverage. Let's say I decide that I don't like this particular law, and I'm not going to get coverage. What are the penalties?
I don't know. I'm not a navigator, and I don't tend to be one. I'm the director of the Progressive Network, who had a dozen navigators in the field. You asked what we brought to the table. I'm a policy wonk. I do advocacy work for working class people on a state level. And how many people in here do not have insurance? So most of you are here probably because you're advocates of what they have in every other civilized nation, which is healthcare. And I think it's really important that those of us that are dealing with this issue understand the big picture of the Affordable Care Act, where it came from, how it's being implemented in South Carolina. In dealing with people, we had hundreds and hundreds of phone calls coming into the network, people looking to get into the affordable care insurance marketplace. And as you've heard, we had to tell people, I'm sorry, you don't make enough money for us to help. One of the memorable phone calls was from a fellow who was really angry because he came to the library to sign up to get his health care, and he identified himself as a West Columbia redneck. And he was raising hell about Obama keeping him from getting his insurance. And I had to explain to him that, no, sir, that's not actually what happened. What happened was it's South Carolina state policy to reject the Medicaid expansion money that would have insured you. That the original Affordable Care Act, it's a torturous construct. Don't lie to people about it. It's a great step forward, but because America, the United States of America, is the only industrialized nation that's commodified healthcare. We have a for-profit healthcare system that it's very complicated, and that the Affordable Care Act was born at the Heritage Foundation in the mid-'80s. The Heritage Foundation is a very conservative think tank, and the reason the Affordable Care Act, which became Romneycare, the first implementation by a Republican governor, was to head off this type of single-payer health care as a right that all the other industrialized nations have. See, like we have freeways and B-1 bombers as part of our citizenship. All the other industrialized nations have health care as part of their citizenship. The United States is the only place where, you can have health insurance, get broke because of your health circumstances, they'll take your house away from you. So we need to understand what the hand that we've been dealt and what we're doing. And in South Carolina, it's particularly painful because the reasons that we turn down the money are reasons that I can't explain. They seem to be political reasons. And the guy that called himself a West Columbia redneck when I told him that no, it wasn't the president's trying to ensure everybody, there's 707,982 people in South Carolina below that poverty level that were supposed to get a Medicaid card. And they didn't get that Medicaid card because the people that make policy in South Carolina didn't want Obamacare. And so that's like a political decision that was made, that people need to understand the state policy. So when we have people that come in, we're trying to do the best we can. The Palmetto Project has all kind of different ways that you can get help with health care. But we're trying to educate people as to what the state's policy is, or I am anyway, as the healthcare advocate for the Progressive Network. And so they understand how the Affordable Care Act has actually been blocked in South Carolina. One more point here, to understand how difficult it is that the House of Representatives, and when they passed the Nullify Obamacare bill, actually passed a bill that, if it became law, would make it illegal for us to be meeting here tonight. It would make it illegal for any agency, a library, a school, a city, that gets public money to help anyone get into the Affordable Care Act. And so it's no wonder that people don't know about it.
Okay. Thank you, Brett.
You had a question, though. He's a navigator. He can answer.
Yeah, they're going to answer our questions. Thank you very much for offering. The penalty for if you don't have a coverage. Lee?
If you do not have coverage in 2015, the penalty has risen to $295, or 2% of your household income, whichever one is greater. And so I think that's something to consider. A lot of people hear that number. In 2014, it was $95, or 1% of your household income. It has risen, and it will rise again in 2016. But whichever one of those numbers is greater, whether it be 95 or that 1%, or 295 or that 2%.
Fantastic. Okay.
It's per person.
Per person?
Right, so not per family, it's a per person fee for not having insurance. The important
Explain that to us. Expand on that.
Sure. The kid charge, if you choose not to insure your children, is half of what the adult charge is, and the penalties will continue to rise as we go on. We're looking at 2 years from now, it'll be $695 per adult, or 2.5% of your income, whichever is greater. And remember, that's per person. It is also important to remember that there are exemptions to that. So if you had special circumstances in your family, you can apply for an exemption to that penalty. The other thing that is important to remember is that you're not going to be taken to jail if you didn't pay this. This is a fee that will come out of your tax return. So if you were due a refund next year when you file your taxes for 2014, if you were due a refund of $95 for you as one person, you're not going to get that refund next year. It's going to go to the IRS. So the IRS is levying these penalties, and they'll come out of any refund that's owed you, but they can't put a lien on your property. You won't go to jail if you have that penalty. But a lot of us rely on our refund to come back to us to pay for those extra things that we don't have during the year. So it will come back and hurt us when we count on those refunds.
It's also important to note that is a one-time penalty. You'll pay your taxes. It's not a monthly penalty. You'll see it one time when you file, whichever year you file your taxes.
Fantastic. Good. Let's get back to the marketplace. When can I enroll in Medicaid through the marketplace? Sue?
Medicaid, right now you can apply online with our state agency, or you can do it through healthcare.gov. Personally, I think it might be quicker to go directly to the state agency's website, only because if you go through healthcare.gov, if you know you're applying for Medicaid, it has to be then redirected to the state agency. And so for people who are currently eligible for Medicaid, and we're not talking about the folks who aren't going to be able to get it because they're in the coverage gap, but we're talking about, for example, children who are up to 206% of poverty. So that means if you're in a family of 4 and you're making, I forget what 206 is at this point. Thank you, Shelley. $59,000 a year. Your kids can get Medicaid fully covered in our state. And so when you're thinking about how do I afford it for everybody, you want to think about how do you put it all together. If you're a family and your children are on Medicaid and you are very low income, if you're below 62% of poverty, so if you make about $8,000 a year and you've got children in your house and they're on Medicaid, you can apply. So while we do have a coverage gap, and Brett's right, we have a coverage gap for adults who are over 62% for a family, 62% of poverty in a family, and for adults with no children in the household who aren't disabled, they just can't get Medicaid, they can't apply because they're not eligible. But we do want to make sure we keep encouraging folks who are eligible, because a lot of folks are eligible and they just didn't think they were and haven't applied. And we need to be getting that information out and making sure that those who are eligible get it, and then working to make sure that those who aren't getting it because of state policies, we change those policies.
The other important thing to know about Medicaid is that there is no end to open enrollment. So for Medicaid, you can apply at any time. There is no date after which you can't apply. So that's different from the health insurance marketplace. So there are different dates depending on what kind of coverage.
Okay.
So this sounds really complicated. I'm seeing some of you like, oh, this is way too much. It is really complicated, and I'm sorry that it's complicated. I wish that it weren't so, but it is. So there is lots of help, though, available in our state and also from the feds. There's a federal call center where you can call and get help 24 hours a day, 364 days a year. I think they're closed on Christmas Day or something. We also have a statewide hotline that you can call. We've got a state website that Appleseed hosts called Sign Up SC, that you can go there and get help. There are certified navigators, there are certified application counselors, and there are certified agents and brokers in our state. So there are lots of people who are local. All the help is free. It's all confidential. So the only question, like you've always heard, that's a dumb question, is the one you didn't ask. So you've got to ask. You need to get the accurate, fair, impartial information to make decisions for your family. We would like you to do that sooner rather than later, because if you're eligible for marketplace coverage, for an Obamacare plan in the marketplace, those dates are not always open. So the open date is November 15th, but the close date is February 15th. So it's a small window at a time when a lot of us are really busy. It's the holidays, you're on vacation, your kids are out of school, schedules are wacky, and that's the time when you have to make some really important decisions.
There's a special enrollment period that we're in right now. It doesn't end if you have a special problem like getting married, moving, graduating from school. So there's this long list of ways that you can get in. If you lose your job that had insurance, we actually have sent letters to, how many jails, Wayne? Lots of jails. We've sent letters to all the jails and the prison system that we've asked them to post this notice that if you get out of prison or jail, you're in a special enrollment period, you can get insurance.
Fantastic. The other marketplace question, when can I enroll in private health plan coverage through the marketplaces, and what should I expect?
Well, the
November
open
15th
enrollment is November 15th through February 15th. So that's if you could have enrolled last year, you chose not to, or your circumstances had changed and you hadn't asked anybody for help in the meantime. There is this special window when you can go and get into the marketplace outside of birth, marriage, death, divorce, loss of job, kinds of stuff, okay? So that period of November 15th through February 15th is an important time that we would strongly encourage you to find out what your options are. And you're not committing to anything by calling and getting your questions answered. You're gathering information. I like to window shop. Before I make a purchase, it's about window shopping. Get the information, then you can take it home and discuss it with your family and decide which direction you guys want to go before you make a financial commitment. You have time to do that.
And by the way, there's information in the back. Please pick up the information in the back. There are numbers on the back that you can call, some of the numbers that's being referred to tonight. One question.
And
about,
Henry, I just wanted to add, if you go to signupsc.org, the other thing that's on there is there will be a calendar so that you can actually make an appointment with a navigator or a CAC, but also local resources. So you may want to know who's doing what in your area, whether there's going to be an information meeting that people can go to so they can hear about the Affordable Care Act. All of that will be on there, and it's only for South Carolina. And so we have partnered with so many other organizations to make sure we have all their information up, as well as making sure we have telephone numbers and ways to get in touch with those who can help you with either enrolling in the marketplace or looking at all of your options, as well as understanding how you can go to the Medicaid program.
One of the things that we need you to talk to your family members and your neighbors, because they trust you more than they do other people, because they think everybody's trying to sell them something.
good point.
And what we found, we've done a lot of door knocking and canvassing, and what we found is people that could have gotten into the exchange and gotten a subsidy, their answer is, I don't have any money. I can't afford it. And anybody that's making over, next year it's what, $11,670, can get a free policy, and they don't know it. And one of the reasons people in South Carolina don't know things is that the state of South Carolina refused $48 million this year to help you know it. So it's really up to us, guys.
Okay. There is something called catastrophic plans, and they look even cheaper than the normal plan. What are those, and who can buy one of those if they wanted to? Let's start with Brett.
Well, that's the one that if you really don't have any money, and if you're young and healthy and you don't think anything's going to happen to you except a car wreck, get that one. And I don't know, what, they have cost?
Well, there is a cost to it, but there are limits to the services that you can get at the lower cost. So you would get like 3 office visits a year, but the deductible is very high. So the deductible for an individual would be like $6,250. I don't have that kind of money, but you'd have to be under 30 in order to get that plan, or you would have to have an exemption because your employer insurance for your spouse is too expensive. It's kind of convoluted. The bottom line, though, I think for a lot of people who looked at them, was that catastrophic plan that used to be when we used to look at insurance was really cheaper. For a lot of people who looked at it, and even those people who were under 30 who thought, I never go to the doctor, why do I want a plan that covers doctor's visits? It was actually cheaper for them to get the plan that paid $4 for you to go to the doctor and your medications were $4. It was cheaper to get a plan that gave you real access without lots of money than it was to get the catastrophic plan. In the people that we helped last year, I had 0 people who chose a catastrophic plan.
Because what you want to think about is, you pay now or you pay later. And so if you get the silver plan, you actually do get a subsidy. That's where you get the subsidy with your premiums, or you get it with your cost sharing. The bronze plans, the catastrophic plans, you're not going to get the kind of help that you would get with the silver plan. And, part of the reason we want to encourage people to purchase health care is not just for the catastrophic time when it happens. We want people to think about, well, if I take care of myself now, I'm going to be healthier and more able to be participating in the world through work and by being being able to be there for my family. And so those are the kind of discussions that we should all be having with folks when we're talking with them. Well, we might not be able to say buy this plan, and we're not navigators, so I don't have to abide by any of those rules. But what you want people to think about is, well, if I do have to buy medicine, if I do know that my blood pressure is high and I need to take care of it, even if I'm a young person, if I get this plan that I'm going to get a subsidy with and I'm not going to have to pay much, and that I do get to go to the doctor, I do get to get checked up, I do get to find out if there's something I need help with, we really need to have those really important discussions with folks. And I'm not a healthcare provider. I'm a lawyer. I mean, what do I know about healthcare? But I do know that when you talk to folks, you want to make sure that they think about all of their options. And healthcare.gov has a lot of wonderful information on it. We try to have a little bit simpler on Sign Up SC, but it's hard to make. This is complicated stuff, and that's why don't think you have to do it all by yourself. There are wonderful, wonderful resources out there to help people and that's why it's called navigating. You navigate through really complicated decisions. Those of us who've had insurance for a long time have to think about all of those decisions, and they're not easy for us. I wish I'd had someone to help me think through that and make those decisions when we're trying to buy insurance, so that we do what's right for our families, we do what's right for the people who we work with, and we do what's right for our community.
I have two Medicare questions. Medicare, that's what it says. So perhaps you can help me. I'm going to read both of them.
We'll refer you.
To a navigator? No.
Well, actually, important to know about Medicare. So if you are already receiving Medicare, then the Affordable Care Act coverage is not for you. So you already have, as a Medicare beneficiary, you already have a really complicated, more complicated than the Affordable Care Act, in my opinion. Can you believe it? It's more complicated for people over 65 because you have more options and more insurance companies to choose from in Medicare than you do with Affordable Care Act coverage. But our windows of opportunity are sort of crossing. So if you're over 65, there are people who are like navigators for the Affordable Care Act, but they're called SHIP counselors. So I don't want you to think, don't misunderstand me, I said SHIP counselors, who are available in your communities to provide free services. They are typically aligned with your area agency on aging. So that is the community-based service. And then, as there are with the Affordable Care Act, there are agents and brokers who also can help you with Medicare insurance choices. So in some ways, the Affordable Care Act is structured like Medicaid, where there are community-based folks and there are agents and brokers. And then it's really up to you as the consumer to decide where you'd like to get your help. And there's no rule that says you can't go to an agent and broker and come to a navigator and go back to an agent and broker. That's all up to you. You're the consumer. You make the choices about this, not us.
What happens if someone missed the enrollment period for Medicare Part B? Is there an option for them in the marketplace under ACA?
No, there isn't.
Sorry.
So, if you have other coverage that meets the federal definition of minimal essential coverage, like TRICARE, like VA coverage, like Medicare coverage, then you are not eligible to purchase a plan with financial assistance. You could purchase a plan if you wanted. It would be like getting secondary coverage, but you'd be paying the full price. So yes, you could, but why would you want to?
Lee, I'm going to direct these two questions to you, part of which we've answered. But one, what recourse do you have to obtain insurance coverage if you have lost your job? And two, do you need to have a job to get marketplace coverage?
Okay, so I'll answer the second question first. Not necessarily need to have a job, however, you need to have income. As we mentioned, you need to make at least $11,670 this year or in 2015 in order to purchase coverage through the marketplace. If you don't, then you can qualify for an exemption and then see if maybe you qualify for Medicaid, or we have a list of federally qualified health centers that you can go visit to get your health needs met at a sliding fee scale. Let me repeat the first question.
The first part of it was, what recourse do you have to obtain insurance coverage if you lost your job?
So if you lost your job, you have 60 days in order to apply for health insurance coverage to the marketplace. That's called a special enrollment period. So you could do that at any point in time, whether it's during the normal open enrollment period or whether it happens in March or whatever point in time in the year. You've got a time period from the date that you lose that job and that coverage to go to the marketplace and see what options are available for you.
Well, and I think the really,
I was just gonna say, and if you miss,
don't get COBRA.
Well, yeah, COBRA is very
Because
expensive.
it's ridiculously expensive. So this kind of eliminates the need for anyone to ever sign up for COBRA.
But you also need to be very mindful of that 60-day period. But if you miss it, and it's because, and I actually worked with someone who helped get them into the marketplace again, because they actually, well, there's lots of folks who are very supportive of the Affordable Care Act, and there are now brokers and agents who are certified to sell these policies, there's still some who don't like the Affordable Care Act. And if you get misled by an agent so that you miss your 60-day period. Or a navigator. That you missed your 60-day period, you can appeal to healthcare.gov and get an exemption from that 60-day and get your insurance. And we did help someone do that one not too long ago.
Okay. Good. Any other comments on that? This is also a two-part question. The first part, how do we address companies with extremely high deductible? Do we have to choose this insurance from our employer? Can we apply for affordable care if our employer has high deductible? I think we need to stop there because that's a lot. Who would like to take that one?
Well, the answer is maybe. And it depends. Sadly, the way the formula is written in the Affordable Care Act, the determination of whether your employer's insurance is affordable is only based on the premium cost for you as the employee. Okay, so it doesn't matter what the deductible cost is. It doesn't matter what the co-insurance is, if it's 20% or 30% or 40%. It doesn't matter what the cost is of my employer's coverage to cover my family. They only use the employee, the self-coverage premium that the employee pays to determine if your employer's coverage is affordable. Most employer coverage is affordable. And it is. It's 9.5% of your family's taxable income. So it sort of doesn't connect, right? So it's your employee-only premium as a percentage of your family taxable income. So if your premium for covering you as the employee that you pay exceeds 9.5% of your family's taxable income, then you could get coverage in the marketplace and be eligible for the premium tax credit, cost sharing if your income is between 100 to 50. So there are some options, but for most of us, 80% of our country has insurance through our employers. And most of them meet the criteria for minimal essential coverage. Most of them meet the affordability requirement. You can ask human resources and in your company, and they will tell you that. It's an important decision that they made with the broker or agent who helped the company choose the insurance. They know that, and so they can share that with you. If you're having problems figuring that out, though, you could meet with a certified person who could help you figure that out.
The second part is, if you lose a job and lose your insurance benefits, how soon can you apply for insurance through the marketplace?
You can actually do it. You could do it immediately. You could actually do it if you had advance notice. You could do it 30 days before your actual end of coverage date. Okay. So let's say on the 1st of the month, they say, Shelley, you're going to lose your job at the end of this month. If I go to the marketplace and I sign up for coverage by the 15th of the month, then my new coverage will start on the first day of that next month, so I would have no gap in coverage. Okay, but I do have, let's say they say, Shelley, effective today, you have no job anymore, and I lose my coverage. I now have 60 days after that when I could still go to the marketplace and see what my options are and elect coverage 60 days after.
We got the list of closures from the Department of Commerce of companies closing. Fram Filter closed a big one in Florence, laid off 1,000 people. And these are projected, there's a federal law, if you have more than 50 employees, you have to tell them 6 months in advance in post the closures. And so we got the word out in some of those factories, and some of the human resources people actually help their employees know that when the plant closes and their insurance runs out, they can do the special enrollment period.
That's
So
good.
it works well if you're at a big company, but we know that most businesses in South Carolina are small. So they have less than 50 employees. So they could let you know today. You know, we're also state where you can lose your job for any or no reason at any time. So when that happens, you would have 60 days.
Well, and the other thing to remember with, Shelley just made the point about if it's a small business, there is no obligation to provide insurance if you're a small business. So now, if you are a big plant, then there are certain obligations under the ACA and there's penalties. But we don't think we're going to see a lot of small businesses suddenly take up insurance. But what it gives you the opportunity to do is to go into the marketplace and to say, my employer doesn't offer insurance, and now where you were in the same position last year at this time, my employer didn't offer insurance, now you can go into the marketplace, and not only is there an affordable policy available, there may also be a subsidy available for you to make it really affordable for you and your family.
Good. Brett, what kinds of coverage count as minimal essential coverage that would satisfy the new law?
Well, I mean, there's so many variables, as you've heard, that's an individual choice, but what I think most of us that have been helping people are encouraging people to look at what's referred to as the silver plan. There's the bronze plan, the silver plan, and the gold plan. Are we going to have platinum this coming year? Mm-hmm. We are?
We are. And there actually are.
And those plans cost more, but one of the things, putting it in perspective, I can use a personal experience. My wife and I had a joint income last year of $23,000. And she went on to the marketplace, was navigated by Wayne there, and found a silver policy with reasonable deductibles and I think $4 to get her medicine for $440 a year, and the price on the policy was $4,200. So her policy was subsidized about 87% predicated on income. Most people, the average income in South Carolina is $23,000. So most people in South Carolina can get a good policy for $40 a month.
But there
they don't know
is
it.
a definition of minimal essential coverage. So your plans to meet that definition have to cover essential health benefits. So these are things, they do include mental health coverage, which if you've had coverage before, we used to kind of separate above your neck from below. Now that coverage is included.
Except for your teeth.
Yeah, so your teeth still, your dental coverage, you can get it through the marketplace, but you pay extra for it. It's not included in your medical insurance. But mental health coverage, prescription coverage, lab coverage, x-ray diagnostics, CAT scans, inpatient coverage, outpatient coverage, maternity coverage, what else? It's kind of everything, emergency room,
So
all that kind of stuff.
There are 10
Essential health benefits.
that have to be included in the plan. And if your health care plan there was a discussion about the high deductible. If the health care plan that's being offered by your employer doesn't meet that minimum, then you do get to go into the marketplace. So it really is important to to look at that, to know that, so that you can learn whether or not you have to take your employer's coverage, or you could go into the marketplace and you could get a subsidy.
Shelley, would you give us some information or some statistics on what the last year's enrollment period yielded for South Carolina, both by numbers, if you can, and by demographics?
Well, there were about 118,000 people who enrolled in coverage in South Carolina, according to the federal government. So they keep all the statistics. We know some more information about folks, but not a lot, not as much detail as I would like. We know that about 88% of people qualified for financial assistance. So that means that almost 9 out of 10 people qualified for a tax credit to help with the monthly premium or the cost sharing reduction, which helps with actually using your insurance, the co-pays, the deductibles, the co-insurance of actually going to the doctor. So does everybody understand that they're kind of how health insurance works as a premium? So think about your car insurance. You pay a premium every month, whether you get into a crash or not, right? So health insurance works the same way. You're going to pay a premium every month, whether you go to the doctor or not. But when you have a crash, then that's when your deductible comes into play, right? With your car insurance. Your health care is the same way. When you start going to the doctor, when you go to have a test, when you get a prescription, then all of a sudden that deductible starts to matter. So for a lot of people who, based on our average income, a lot of people qualified for both kinds of financial assistance, the cost sharing reduction and the advanced premium tax credit, okay? So that meant that for a lot of people, they were getting coverage. When we said affordable, we are serious about how affordable it is. So, I have a staff member who had it before she came to work for me, self-employed person. She worked as a DJ, she worked as a wedding planner person. She made about $12,000 a year as a self-employed person. She was able to get a plan, and the cost of your premium is based on your income, your age, and which county you live in, okay? So it's not based on whether you're a man or a woman anymore, all right? It's not based on whether you've ever been sick in your life, you've had cancer or anything, you're obese, thank you, or anything else like that. They don't ask any health question except do you smoke. So once you figure out what that premium is, most people, when you take off your tax credit, you're paying $20, $30, $40 a month. So way less than you pay for your car insurance.
One of the
Okay?
things that's
And
not,
then your co-pays for like your medication, you're talking about $4.
one of the things that's not clear that you need to help share with people is this business of a tax credit. Sounds like something you get back after you pay for it. That's not the way it works. It's like you're actually getting subsidized, and I don't think they want to use that word, so they may advance premium tax credits. But if your policy is $4,000 a year, and you're only making $23,000, you're actually going to be writing a check for $40 a month, as opposed to writing for the whole thing and waiting for something to come back to you.
So you pay it every month, and the federal government pays their part every month.
It's kind of like the earned income tax credit, where you could, although with the earned income tax credit, you can get that all at the end of when you file your taxes, or if you need the money during the year, you can actually elect to get that money in your paycheck every pay period, so you don't have to wait. Now, sometimes you like to wait because it's nice to get a nice little check or a big check near the end of the year, but if you need it to make things stretch, so that you want to look at it this way. The insurance company's getting your money each month because they want their premium money. It's getting paid directly to the insurance company, and this way you're keeping up with your insurance payment, and you're able to get to the doctor, and you have money in your pocket to pay all of your other bills.
Fantastic. Any other comments on that? Okay. We have our last question. If you have a question, please, we have about 10 minutes more. This question is about legally married couples. How does this impact legally married couples who file separate tax returns? Is there?
That's a great question, and one of the challenges with the Affordable Care Act. So if you are married, you must file your taxes married, filing jointly, in order to get the tax credits or the cost sharing, unless you are a survivor of domestic violence, or if you are an abandoned spouse. So let's say you're married, but you haven't seen him in 10 years, wouldn't know where to find him if your life depended on it. Essentially, that's an abandoned spouse. So you would still be able to get the advanced premium tax credit for your insurance. You don't have to have any proof of this, so you don't have to worry about bringing in, police reports of every time they came out for domestic violence. This is your attestation. So you are telling the federal government, yes, I, Shelley Quenga, am attesting that my spouse is abandoned, and I'm married filing separately, and that's fine. That is acceptable. But for most of the people that we help who are married, you must do married filing jointly in order to qualify for assistance.
Wow. Are there any other questions from the audience? If I get a summary wrap-up question, yes.
Well, actually, what we would prefer that you do, we have a toll-free number that you can call. It is 888.
Sorry about that.
998-4646. And there are also some little cards back there that have our phone number on it. You can call that number and we will find who the navigator or certified application counselor is that is closest to you. So that way you could also share that number with your family that lives in Greenwood or lives in Florence. It's one number for the whole state.
And that information's on the back table?
Yes, so it's on our little Palmetto Project cards at the back table. It has our number on it. And then we'll also be able to schedule an appointment for you if you wanted to do that with one of those navigators, or you would also be able to go online and make your own appointment. That part should be up by November 1st, where you could actually go to the Sign Up SC website and get to the calendar, and you could say, well, I want to meet with Lee at the main library on Tuesday at 11:30. She's got an available appointment. I'm going to put myself in there. And you can elect to get text message reminders or email reminders of your appointment.
A question here?
Previously, you said that, you have to file jointly with the tax credit.
Right.
But when a married couple file for a premium or policy in the marketplace, they can do that separately?
They could choose different policies if that's what you're asking. So let's say I want to go to Palmetto, but you want to go to Lexington. We could choose different carriers that covered our hospitals and our doctors, so that we would still be able to see the doctors that we continue, to want to see.
And you'll have different premiums on that.
Exactly, exactly. So there's every company, so there are 5 companies that sell insurance in the marketplace, and then they each offer plans. So when you go to look at them, you might be choosing from, let's say if you looked at silver, and we keep talking about silver because you can only get cost sharing in the silver. You can get the tax credits in any of the metal levels, bronze, silver, gold, platinum, but you can only get cost sharing in the silver plan. So that's why we keep talking about silver. They were the most popular.
And so, and early on you said that to find coverage, you have to deal with progressive. And $11,670.
For one person. For one person. So this is based on your tax return. How many people are on your tax return? And we'll look at a chart with your income and family members and see what you might qualify for.
Okay, so the thing you said, less than that, might not have anything affordable for you in the marketplace?
Correct. You would not be eligible for affordable coverage if you're a single person, or even if you're a married couple. Making less than $12,000, you would not be eligible for affordable coverage.
And that unless you have benefits.
You talked about a benefactor paying for you.
Oh,
unless
yeah.
there's somebody who would
Yeah,
help
so
you pay
Yeah.
for it.
somebody, so you could buy a plan in it, but let's say if you're 50 years old and you're buying a plan, it could cost you $500 a month. And so somebody could pay that premium if they wanted, but if you really had that person who was gonna do that, our suggestion would be actually that you speak with an agent or broker, because here's the things about the plans in the marketplace. They're meant to cover people who don't have any other options. And they're trying to be as affordable as possible, which means the network of providers is very narrow. So like where my employer coverage, I can go to Lexington, I can go to Richland, I can go to Roper, I could go to MUSC, I could go to Greenville. If I choose a marketplace plan, I may only be able to go to one of those hospitals. I might not be able to go to my choice. If I went outside the marketplace and bought a plan, if money was not the issue, then I could choose a plan that had a broad network.
So the first thing you want to do is think about who are my doctors, if I need to go to the hospital, where would I get that care? I mean, you want to think about if you are fortunate enough to have a doctor and have providers, think about what medicines you have coverage. And then, especially if you're thinking about it as a married couple, if each of you know that when you go into healthcare.gov, then you can figure out, and one of the best ways to find out whether or not your doctor is taking a certain plan is call their, they all have an insurance department. Call their insurance department and ask them and say, I'm going to be going on to the marketplace. I want to know out of the different plans that are out there, which ones you accept, and make sure they're very specific. Because there may be, they take one plan from a company, but they don't take the other plan from the same company in the marketplace. So that's where you can do some preparation yourself. And hopefully, whoever you're talking to help you think through what plan or whatever you're going to pick, although they're not going to tell you if it's a navigator or a certified application counselor, they would give you the advice to figure all that out so they can help you figure out which plans have the people you need to go to.
So I think that's an
navigate to enroll, and there are something out there that can help assist you with those training measures. Can that navigator direct me to that?
Oh, yeah. Yeah, the system, actually, the healthcare.gov website will actually calculate that subsidy and your cost sharing itself. We don't do those calculations.
Are you talking about the benefactor that she was kind of joking with me?
There aren't very many.
I don't, I think you were, Shelley was being very gracious to say that. I wish there were lots of
Benefactors.
anonymous rich people out there who do that. Now, there was through Cooperative Ministries some help with paying your premium through the marketplace, and whether that program
It does. It will continue.
They're going to continue
Yes.
that program. So there may be some programs out there, but I wish there were as many benefactors out there helping to pay people's insurance premiums. We might not even need the Affordable Care Act if that was all out there to begin with.
When often that comes up is when I'm with my college-age daughter and my adult child, and I'm trying to help her get coverage, and I say, no, sign up for this plan, honey, and mommy will pay for your premium. That happened often with us when we were with families and trying to get coverage for adult children. So that could happen.
And if you're looking for information about that cooperative ministry plan, there are flyers in the back, as well as Mr. Holloway, who runs that program, so he can help answer those questions for you.
Good. We're going to allow each of the panelists to do 2 minutes around sharing what kind of community outreach or healthcare programs that your organization may be involved in. And let's start with Brett.
Well, the Progressive Network has been focusing on raising awareness about the state's policy on the Affordable Care Act. And it's just stunning how little people know. I mean, we had actually people that were arrested blocking the entrance to the State House in March, I believe it was, to force the legislature to debate Medicaid expansion. The chief of police that arrested us said, Brett, before y'all did this, I had no idea we turned down a Medicaid card for all the homeless people in Columbia. Why did we do that? I had lunch with the Supreme Court Justice Jean Toll. She didn't have a clue about what we call the gap people. Too poor to help. And that guy blaming it on Obama. So the confusion and the lack of understanding is something that we've been knocking on doors. We have lists that we're willing to share with people of 294,217 people in every precinct in the state that would be eligible for Medicaid. Go knock on their door and ask them if they know about it. That's what we're doing.
Are there any upcoming events for your organization, Brent, that you might be holding?
Well, actually, we've rolled on. We were in Sumter today. We'll be in Orangeburg tomorrow at the regional hospital. The regional hospital is co-sponsoring an event in their front yard with us. Again, talking about South Carolina's policy to obstruct the Affordable Care Act in any way they can. But we're doing 10 cities in 10 days. We're on City 3, and in those cities are county seats, and each county has over 10,000 people that are registered voters that were denied health care.
Wow. Lee, tell us about the activities. I know we're talking about ACA, but there are other activities that the library has as well. Can you tell us about some of those?
Well, I can. I'll start with our Affordable Care Act activities, however. We are doing community education events, so we can come out to any kind of community group that you have or any meeting that you have and talk about the Affordable Care Act. We can help answer questions, and at a forum similar to this one, we'll also bring with us certified navigators or application counselors. So if at that event there are people there that are able to enroll or just kind of want to get some more information, we can sit down with them and help them do that. We will also, again, this year have navigators on site. Last year they were on the 3rd floor. We had walk-in hours. They were posted downstairs. You can just walk in without an appointment, ask questions, enroll, do whatever it is that you need to do. We will do that again this year. That'll probably start sometime in mid-November. There'll be another forum here similar to this one in November as well. I believe it is the 11th. But please check our website. That is where we keep all of what's going on and all upcoming events, as well as Sign Up SC. We'll post it in both places, so you're welcome to check both of those to see, what's happening and where and how you can be involved. We also have we are certified as benefit bank counselors. So while you may come here and find out that you fall into that gap or you can't enroll in health insurance coverage, we can talk to you about Medicaid. We also provide you with information about dental coverage and all other sorts of things. So we try to make sure that you don't leave empty-handed if, unfortunately, you cannot purchase health insurance through the marketplace. I've got some flyers in the back of the room, an Affordable Care Act handout, as well as some conversation starters. So no matter where you go and who you talk to help answer your questions, it's just a list of questions to say, okay, well, what are my prescriptions or who are my doctors, and the kind of things that when you sit down with a navigator that you would want to ask before you choose a plan. So that is what we're doing.
Good. Shelley.
So Palmetto Project was awarded the statewide grant from the federal government to do navigation for the whole state. So we're operating the scheduling center number for you to schedule an appointment or speak with someone, in addition to the scheduling website. And then we have partners in this effort. So if you have folks who are Spanish speaking, who have questions about immigration issues, we have content experts, people who understand immigration issues and understand the marketplace at the same time, so we can do those things. We have other navigators who are experts on issues for people with HIV and AIDS. We actually just recently at SC Pride that was here in Columbia, a gentleman said, oh, I can't get coverage, I'm HIV positive. Actually, he can. So this is the great thing about the Affordable Care Act. We don't care what your health conditions are anymore. We don't care what you've ever been to the doctor for. You can get affordable coverage because they're not linked to what your health conditions are. So he could get coverage. And in HIV and AIDS and other payment structures for folks with HIV and AIDS to make sure that they understand how the plan they choose could affect their other payments from Ryan White and ADAP, et cetera. We also have a partner in the South Carolina Small Business Chamber of Commerce, because the shop marketplace opens for small businesses across the nation. So that opens in November. That's the first time that small businesses could get employer or employee coverage. So the Small Business Chamber is going to help us with that piece. And then the Richland County Public Library also has a mobile vehicle that they'll be able to take out with PC workstations on board, so that they would be able to do enrollment around the county. And then we also have another partner, DECO, that was the statewide grantee last year, and we were sub-grantee under them. Now this year we flipped, and they're sub-grantee underneath us, but they have navigators that are mostly hospital-based. So those are our navigation partners. Then we're hoping that we have one more partner in the Midlands, so we're just trying to finalize all of that contract stuff now. And then
Well, we're not navigators, we're lawyers, and we do advocacy on a lot of different issues, and we do keep the website so that we can try to keep up with all of the activities that are going around the entire state. We don't just list things that are going on in the Midlands. And in addition, we've got other resources on the website that, like Shelley and Palmetto Project, that gives you in your county where you might go if you need free care, if you need low-cost care, as well as other resources if you're hungry, if you need shelter. So we try to keep holistic resources available that you can go from signupsc.org. You can go onto our main website, scjustice.org, and we will continue to do the work that we do as both lawyers and advocates on both making sure healthcare gets out there, but also to protect consumers and to protect immigrants, to protect those who civil rights and economic rights are being harmed. So we welcome you to look at our site because we think there's probably some kind of information on there that might help somebody.
Great. Are there any final comments you'd like to make about the importance of being registered, getting into the marketplace? Lee?
I would just start with saying the importance is just to go and to figure out what you qualify for. You don't know until you look. There are many options, and in order to make an informed decision for yourself and your family, just go and see what's out there. Go and see what you qualify for, and then make a decision whether you want to purchase self-insurance, whether you don't, which plans you want. It doesn't hurt to look. It is free. You have plenty of navigators, not only in this county, but around the state, who will help you and answer any questions that you have and spend as much time with you as they need to make sure that you leave fully informed and ready to make that decision.
Yeah.
Oh, that's available now.
Right now.
No, not plan.
All of the plan information is not available right now.
Specifically the cost.
But if you have questions, you can ask them now.
Good.
It is the Affordable Care Act. And a lot of you probably have seen the opinion polls that have been done that people, how do you like Obamacare? Oh, that's horrible. Well, what do you think about Affordable Care Act? Oh, that's great. And so we've got a lot of work to do to undo a lot of the things that have been said.
Good. Jilly, would you like to comment? Or?
I would like you to feel secure that there are a lot of people who've been working on this for a long time. So the law was actually passed in 2010. So a lot of nonprofit organizations and state agencies have been working together to try to make sure that you have accurate information in the state about what your options are. So I don't want you to think that there are not people out there who want you to get this information so that you can make the right choice for yourself.
Right.
So please ask us. Don't think that there aren't people out there who want to help you. We do want to give you the information. The choices you make are your own, but we want to make sure you've got the information to do that.
Sue?
Ditto.
Ladies and
Take
gentlemen,
advantage of it.
thank you very much. There are more information.